Hello, this is Dr. Jatu Senesi, board certified OBGYN and physician satisfaction specialist at essenceofstrength.com, where I help early career physicians by coaching them to identify, implement, and sustain the habits that promote personal and professional success and satisfaction. Why I am chatting with you all today is because I realize that a lot of times people ask me to tell them my story of leaving clinical medicine. And what I recognize is that I always edit it because it's really long. And I've realized if someone asks me and then I launch into all of it, it's probably more than they really want. So just in case though, there's somebody who kind of wants the whole story or that parts of it might resonate with them or it could be useful, I thought I would just go ahead and tell my story on the videotape, and you can go back and watch it in snippets, cut it off if you're like, this is not interesting, or you can listen to the whole thing and see if some of this might resonate with you, because a lot of what I do in life is to figure out if I can help people figure out what's best for them, and if part of my story can help you figure out the best next step for you, I would love to be able to do that. So, as many of you know, I am a board certified OBGYN. I do not any longer practice clinical medicine. I stopped practicing 6 years out of residency. So to get to that point, I want to actually go way back to the beginning of when I started my journey into the medical career, which actually goes back to when I was 12 years old. That's when I decided that I wanted to be an OBGYN, not just a doctor, an OBGYN. That was around the time I realized that I had a real aptitude for science and a real interest and fascination in maternal fetal physiology. I thought the blood supply was really cool. I thought the hormones were really cool. I thought everything about it was pretty awesome. So I was like, if I want to be a doctor, that's the kind of doctor I want to be. And honestly, I am a fan of autonomy, and I like the idea of being the person that was in charge. Before I wanted to be a physician, I thought that I wanted to be a teacher because I like explaining things to people and educating people. However, I kind of recognized that hierarchy with principals and superintendents and such, and I was like, I think the doctor thing is going to work better for me. And of course, I like helping people. So all those things together made me think this OBGYN thing will be the one for me. So, because despite the fact I left clinical medicine without a plan, that is very unlike me. Going back to middle school, when I decided I wanted to be a physician, I started charting out how I needed to get to where I needed to be. And I decided that I needed a rigorous academic program to get into the college that I needed to get into the appropriate medical school. Thus, I applied to a STEM magnet program for high school that I thought would give me the academic training that I needed to be available and to be able to get into the kind of college that I wanted to get into. So I applied, I got in. It was a public school, however, it was a magnet program, and so I was surrounded by a bunch of other people who also wanted to be physicians or engineers, or some not actually anything in science, however, very high achieving folk. So went through high school, was able to get a scholarship to college to be in another STEM program, again, surrounded by folks who wanted to get MDs, PhDs, or MD PhDs. So again, high achieving folks, very focused folks, people who had every intention of continuing in their higher education. So this is who I surrounded myself with starting in high school, intentionally, because I knew that I wanted to be a physician. So by the time the end of college came around, I applied to medical school, and I will say, I wasn't someone who was worried about getting into medical school. I was more concerned about getting into the medical school I wanted to get into. I was fortunate enough that God blessed my cockiness, and I was actually able to get into, I had a choice of schools to go, from which I was accepted into several schools, so I had a choice, and I opted to attend Emory University in Atlanta. So I'm originally from the DC area, so that's the farthest I'd ever lived away from home. Moved to Atlanta, started medical school. And I must say, I did not care for medical school. even though I had been a biology major and had been accustomed to memorizing hordes of facts in order to repeat them back to someone later, the whole drinking from a water hose thing, that analogy that people make about learning information in medical school, is more than accurate. And sitting in lecture, getting a whole bunch of information, cramming all this information in your head was not really my jam. However, everyone said, okay, this is what you need to get the information to pass the first step of the boards. You'll be well prepared for that. And then when you get to the second 2 years of medical school, you'll be seeing patients, you'll be applying what you've learned, and this will be all worth it. So, went through the first 2 years, took step 1 of the boards, passed it, got into the wards, and it was definitely better. It definitely was better seeing patients, interacting with people. I like interacting with people, so that was better. It still wasn't as good as I thought it was going to be. I looked around at my friends who seemed to be enjoying the experience better than I, and I was like, I feel like I'm supposed to like this more than I actually do. However, again, I was continuing to do fine, passing my tests, passing step 2 of the boards, applying to residency, and thinking, well, if this wasn't what I was meant to do, at some point I would have hit a roadblock. I would have failed the test at some point. I had seen people who had started medical school with me who had to maybe repeat a year or take some time off because they had to repeat the boards and they hadn't passed the boards. And so I felt like if God wanted to give me a sign that this wasn't what I was supposed to be doing, there were plenty of options. There were plenty of opportunities for me to have fallen off. And I kept passing tests, so I felt like this is what I was supposed to be doing. So I applied to residency, and I actually ended up matching at Emory, so I stayed there for another 4 years. And again, everyone said, well, you want to be an OBGYN. When you get into your specialty, you'll be taking care of women, so you won't be taking care of old men having heart attacks. Despite the fact that people think that OBGYNs are baby doctors, we are pregnant women doctors. So once you become an OBGYN, you're not really taking care of sick babies anymore. You're taking care of women and reproductive health. So the idea was start residency, specialize in what I want to specialize in, and it's going to be so much more fun. However, residency also a little bit miserable for me. Residency, I think residency is just hard for everyone, so I don't think that that's special to me. It was hard. And we had several years where we were short a person, and so we were just, in addition to the regular just amount of hard work you do in residency, we had to pick up slack because we were short a person a lot of the time. So much so that by the beginning of my 3rd year, I thought I wanted to quit. I called my mom and said, I don't know if I can do this anymore. I don't know that I want to, I don't know that I want to do this anymore. I don't know that this is worth it to me. And she talked me down and said, at least finish residency and then figure out, because it wasn't like I want to leave and go do something else. I was just like, I don't want to do this anymore. So even though I would wake up in the morning and run through all the things that I had to do before I could get back in bed, because I wasn't excited to do anything. I was like, what do I have to get out of the way before I can come back and go to sleep? That was kind of how I approached that 3rd year of residency. But I was like, okay, I'm gonna finish. So then got to 4th year, and that was the initiation of the 80-hour work week for residents, which was a different permutation than they currently have now, because I think we worked still more than residents do now. And it was odd for me in terms of the workload, because in my program as a 4th year, your workload was a little bit lighter, and then you weren't allowed to work more than 80 hours, because I was used to working 100 to 120 hours a week. So that's what I had become accustomed to. So it was interesting that 80 hours actually seemed kind of weird to me. And so I got through residency. Thank God, got down to the 80-hour work week. So by the end of that year, I kind of was appreciative of having fewer hours that I actually had to be at the hospital seeing patients and being at work. And I wanted to come back home. I wanted to come back to the DC area. So I applied to jobs back here, and I was able to find a job in Maryland. So finished residency, had been in Atlanta for 8 years, moved back home because my whole family, my parents, my siblings all lived in Maryland. So I was like, okay, I'll be back home. And I I'll be honest, associated Atlanta with the misery of med school and residency. So I was kind of ready to be gone from there. So I was like, I'm gonna go home. I was happy as a child there. My family is there. It's gonna be great. However, I started my practice, and I liked my patients. I liked the people, I liked my coworkers. I actually liked everyone with whom I was working. I just, in retrospect, I realized wasn't as intentional about designing my life as a doctor as I had been as designing my life to become a doctor. So I dove into the work part of work and seeing patients and figuring out how to time my schedule in a way that I could get my notes done in a timely fashion, so I wouldn't be there for hours and hours afterwards. Because when I first started, I would be in the office after seeing patients, writing down notes and getting everything done. Because again, I'm old enough that when I started practice, we did not have the electronic medical record in my office. We were still doing paper charts. So I just attributed that to transition and figuring out the new process, because even though I was trained very well in my OBGYN residency, your day-to-day as a resident is very different than your day-to-day as an attending physician in private practice. So I had to figure out that learning curve. So I attributed a lot of the dissatisfaction in those first few months to the learning curve. The first sign that I thought that maybe I needed to make some changes in my life as a physician was that first Christmas holiday after residency. I know that when you're the new person, you always work the holidays. My practice covered 2 separate hospitals, and you had the New Year holiday and the Christmas holiday. So I was like, that's 4 options. I'm gonna definitely have to be on call one of those days. And I did. I ended up being on call for Christmas. And that Christmas holiday call was, I like to think of it as a microcosm of everything that is good and everything that is horrible about practicing OBGYN. And coming out of that weekend made me realize, because the work part of work is so much, I have to figure out how to design the life part of work in a way that supports the life part of my life in a way that supports being this stressed out at work. The beautiful part of that weekend was that I got to deliver a patient that I had taken care of for most of her pregnancy. I knew her, I knew her sister, who was also one of my patients, knew her husband, I knew her child. I had seen them throughout the pregnancy. My practice was large enough that I didn't necessarily deliver my own patients, and I didn't necessarily know the patients who I delivered before I went into their delivery. So this was wonderful. It's Christmas Eve. I went in, I did the delivery. We were done by like 8 o'clock. I got to go home and sleep in my own bed. It was fabulous. Christmas Day, less fabulous. Christmas Day, I came in to round on my patients and take care of the people who were still in the hospital. And I was also on emergency calls. So basically, anybody who came into the hospital who didn't have a physician, I was on call for them. And the one person who came into labor and delivery that day for an emergency visit was unfortunately a woman who had a stillbirth. She was 20-something weeks, and the only delivery that I did on Christmas Day that year was a stillbirth. So that was quite the bummer. I was not with my family, and the only delivery I had was a woman who I did my best to comfort, who I didn't know, who had a stillbirth. So the following day, I had plans with my family to get together. They were going to come to my home so I could still be close to the hospital, and we were going to do a little bit of a late Christmas Day thing. They did their full Christmas the day before. So when they were about to be on their way to my home, I got a call, because I had rounded on my patients, I had gone home. I got a call from the hospital saying that we had another unassigned, unregistered patient, emergency patient, for me, that was now assigned to me, and she was in labor. So I had to call my family again and say, gotta go in the hospital, not sure how long I'm going to be there. I think it probably just makes sense for you guys not to come, because I lived probably like 40 minutes away from them at the time. So that was the day that made me realize there are a lot of things about this job I like. There are a lot of things about this job that are not great. And I need to do a better job of figuring out how to have the stuff outside of work support me in the things inside of work, because I know there are a lot of these things that are just part of being an OBGYN. However, I knew that having weekends like that where I was away from my family for the holidays, family who I'd moved back to Maryland to be close to, and most of the things I did were kind of truly bumming me out. I was like, I need to do something differently going forward. So that was the first light bulb that I maybe need to switch some stuff. I didn't think I was going to leave clinical medicine. Like, that was not the plan. I was just thinking I need to do something different with the way that I practice clinical medicine so that it works better for me. So continuing on into my first year in private practice, finished the first year, by going into the second year in private practice, we had actually switched to an electronic medical record. I had just gotten the hang of doing the paper charts, and then I had to switch to the electronic medical record, which was the bane of my existence. I just not a fan. Just gonna leave it at that. At the same time, in an effort to compensate the physicians for doing that unassigned, unregistered call at that one hospital, a process had been put in place to pay the physicians to take that call, which was, yay, great, help me pay down my school loans. However, you had to be in-house for those shifts, which of course makes sense. However, the way it was initially set up and the way those schedules were set up, I would be in the hospital for literally days at a time. My hospital day, I had two scheduled hospital days. So I was there on Mondays and Tuesdays. And so then if I had the weekend, I could literally be there from Friday night till Tuesday night, in-house, couldn't leave. Sometimes some of the other doctors were kind enough to just like, we'll cover the pager for you so you can just like run across to Safeway just to get out of here if you want to. So these are things that also contributed to my decreased satisfaction in work. And I realized that, okay, you know what? I can at least make it until taking my boards, and then I'll reassess. As an OBGYN, because you just take tests forever, your final certification exam is your oral board exam, which most people take at the end of after their second year. Your first year is just kind of your acclimation to private practice, and then your second year you start collecting cases to submit to the board of examiners, and so that they can review your case list and ask you about how you take care of your patients. So I was like, let me just get through the boards, let me hit that benchmark, and then I'll reassess. So I went, took the boards, thankfully passed again, got to the passing my boards, had been in practice for at this point 2.5 years, and I was just like, I don't like my life right now the way it is practicing medicine, and I'm not sure what I need to do differently to make it better. And because because of the type of person I am, and I'm very similar to many other physicians, I figured there was something wrong with me and something needed to be fixed. So I went to see a therapist because I was like, okay, there must be something wrong with me, fix me. And in speaking to the therapist, I realized there were definitely some things that I had that I could work on. However, there were also some things in the system that were contributing to my dissatisfaction. And truthfully, we determined that I was just burnt out because I had been going to school continuously since I was 4 years old and really not taking a break. And I probably just needed a break. So I did what nobody does, and I was an academic. I didn't have a child. I took what I like to call a sabbatical. Some people are like, you just took a break. I took a break. I took 100 days off. It was a completely random number. It seemed like a really long time. So it was like 100 days. That's plenty of time to recover and stop being tired. And my main goal was to get over feeling so tired and to figure out a plan to keep from getting that tired and exhausted and burnt out again. That was my goal for my sabbatical. And I picked, again, random days. I was like, I started it on my birthday, which is in January, and I was like, I'll come back at the beginning of May. And because I'm me, I didn't really relax. I was like, I have vacation. I like vacation. That's one thing that I, even during my depths of burnout, always took vacation all over the world. I'm like, I'm getting out of here. So during this 100 days, I went to Panama on a medical mission. I went to Puerto Rico and did 2 weeks of a Spanish immersion course. I went to Switzerland on a ski trip with some friends. I went to Colorado on another ski trip with some other friends. I did what I call my East Coast road trip and drove down the East Coast and visited friends in North Carolina, Georgia, and Florida. So I was kind of all over the place. So I wasn't at work. However, I probably wasn't decompressing as well as maybe I needed to figure out my next steps as well as I needed to. So right when I was starting to get decompressed was when I needed to go back to work, and I did not want to go back. However, I had promised them I was going to go back, and I felt so bad for taking that time off in the first place because I knew when I wasn't there, that was extra work for other people. So I was like, get it together. You said you're going back, go back. So I did. However, I had already planned when I went back that I was going to have some changes. The fortunate thing about the practice where I was is it was big, and we had offices in the close-in suburbs and the far-out suburbs. So I had initially been in the far-out suburbs, and I decided I needed to be in the close-in suburbs because I needed to have a life outside of work. And I was like, single, no children, why am I living way out, away from the city? If I wanted to hang out with my single friends or my friends even from before I left, everyone was closer into the city. I lived like 40 minutes out from all of them. So I decided that I was gonna live closer in, be at our most southern office, switch to being at our more southern hospital, still go to the office that I had originally started in at least one day a week because the vast majority of my patients were there, and still take some call at the other hospital. However, I almost kind of completely changed my practice setting staying within the same practice, just switching it up, seeing what's going to make it better. I also moved to a 4-day work week because I decided that maybe having one day off was going to be better for me in terms of maintaining my energy. And about probably a year into this new setup, I started having those burnout symptoms again. I started having those dissatisfaction symptoms because I was still doing in-house call. Even at the new hospital, we still had in-house call. I still had the EMR, and I really, even though I said I'm moving down to closer to the city so that I can be more social, I still wasn't, I'll be honest, I wasn't as intentional as I needed to be to design my life outside of work to make it enjoyable. So I was really good at work, and that took no effort to maintain taking care of patients and being a hard worker at work. I was not as intentional about designing my life outside of work. So I got to the point where I was so exhausted from work that I didn't have the energy for life outside of work. So I got myself back to that space again, even more quickly this time. So what did I do? I went back to my therapist. So I was like, I did it again. I'm broken again. What can we do? And at this point, I think I actually felt bad. I felt like I stressed my therapist out. She ended up sending me to a psychiatrist. She was like, maybe you need medication. Maybe you need medication. So went to see a psychiatrist. She started me on SSRI, because we decided maybe I had some anxiety and maybe that was contributing to some of my issues. So I may have had anxiety. Let me tell you that going on that medication, it removed any anxiety, so much so that I became completely apathetic. I think the only thing getting me up every day going to work was that sense of anxiety, like I had to get all this stuff done. Once I was on the medication, I was like, maybe I'm late. I'll get there when I get there. They'll see me when they see me. It was not good. So when I went back to the psychiatrist for a med check, I was like, I don't think this is a good fit for me. And she's like, maybe we should try something different. I was like, I don't think medication is a good fit for me. And that's around the time I was like, okay, maybe I just need to not be doing this anymore. So I thought maybe it's the OB part that's making it miserable for me. I used to joke with one of my friends about, does call make you hate your job, or does call make you realize that you hate your job? Because call is painful. And then if you have to go in the office the next day, it's just that much more painful. So I was like, maybe I need to get rid of the OB and do GYN only. So I even looked into doing a fellowship. I was like, maybe I'll do a minimally invasive surgery fellowship and that will work for me. And I reached out to some people I knew. I reached out to one of my attendings from residency, and he was like, you could do that. However, have an idea of what you're gonna use it for. Don't just get the training and then don't know how you're gonna apply it once you get it. Talked to another person with whom I had done residency, who was the head of minimally invasive surgery at his hospital. And in the conversation with him, he was like, it sounds like you just don't want to practice medicine anymore. I don't know that you actually want to do a fellowship. And I was like, you might be onto something there. And so I really realized that I just needed a break. I didn't know how to do this job that I had always wanted to do, that allowed me to help other people at the same time that I was able to keep myself satisfied and feeling well. I knew that there had to be a way to do it. I just couldn't figure it out. And at that point, I was like, maybe there's something else that I can do, that I can help people and be of service to people and still have this sense of feeling happy and fulfilled and satisfied every day of my life. So that's when I decided. I was 35 at the time. I went away for my 35th birthday. I remember I went to a spa and I was just kind of chilling out, getting massages, doing yoga, thinking about my life, and said, you know what? I think I'm gonna go do something else. I did not know what I was gonna do, which was very disconcerting to pretty much everyone in my life except for me. I was just like, I'm just not gonna do this anymore. I was like, I'll figure it out. I was like, I'm young enough to go find something else. I was like, I'm board certified, so if this doesn't work, I can always come back. It's like, however, I'm old enough and I've been doing this for long enough to recognize that this isn't working for me. So I came back from my spa vacation. I remember emailing all my closest friends and loved ones and saying, talk me out of this because I'm about to quit my job. And most of them were just like, well, we know you're not happy, so maybe if you need to do something else. I think the fact that I had taken that 3 months off a few years earlier made this not as shocking announcement for them as it might have been in another circumstance. So my best friend was just like, how can you quit you can't quit without a plan. You gotta have a plan. And I was like, watch me. I'll figure out a plan at some point. So without anybody to talk me out of it, I sat down with my boss and I said, I'm putting in my resignation. I'm gonna not work anymore. So we had 180 days notice to give. So I worked for the next 6 months, and that was probably the happiest I had been because I knew that I was gonna be done. And again, I had no plan. I had no plan for a while after that. I'll do another video discussing how that no plan situation worked and how that took a little while and how that led me to doing what I do now. However, I just want to let people know that there was no big, terrible thing that happened. There wasn't any like something came to a head. It was just a sense that I deserve to have a life that I enjoy while I'm helping other people. I just, in my heart, in my spirit, always knew that was true. And doing all the things I could think of to make that be true while practicing clinical medicine didn't work for me. And I'm not saying that, I think now in retrospect, there may have been things, I can think of things I could have done differently to make that work while I was practicing clinical medicine. However, at the time, I was at the end of my rope and I decided I'm just gonna start from scratch. So that long story is the story of how I ended up leaving clinical medicine. Again, I am Dr. Jatu Senesi of essenceofstrength.com. I now work as a coach and physician satisfaction specialist, particularly working with early career physicians who may have that same issue like I had early on, where I don't know what I need to do to make that combination of success with satisfaction be present in this life as a physician. So because I've gone through that struggle, that's what makes it that makes me so passionate about helping other people who have the same issue. Again, I'll do another video explaining to you the whole another circuitous road that got me actually into doing this work. But if you are interested in talking with me about similar struggles that you might be having, I do offer a complimentary clarity conversation to discuss any current challenges that you're having and any future goals that you have, and see if maybe we can work together to help you get some clarity and get some strategies to make that happen. You can reach out to me at essenceofstrength.com. Until then, I wish you the best of luck as you seek to find satisfaction in all your success.